for excuse me, a few more minutes. Please come in and join. Thank you. Good afternoon and welcome everyone from a possibly sunny Brussels. So this afternoon we are focusing on beating cancer with better environments. And this is, I think, something that is key. Europe has a focus on beating cancer at the moment, and we have a focus at this particular moment looking at the role of the environment. We're going to be featuring the launch of a report by the European Environment Agency, and we'll hear a little bit more about that report in a moment. But just before I do, I just need to let you know that this event is being live streamed and live tweeted, so thank you to those who are joining us from the social media environment. We'd like you to use 2 hashtags, that's FOEDE and EEA Cancer Report. So that's what we'll be using to help follow the conversation and track it online. And we're hoping at the end of our 1-hour conversation to have recommendations that we can use to take things forward, because this report is a narrative shift. In the past, we've focused on making sure people understood the damage to health that comes from different environmental determinants. So now we're moving on from that, assuming that there is an understanding, we're now taking the point, what can be done about it? And recognizing that the cancers of tomorrow are linked to the exposures of today. So if we really want, at European level, to have an impact on cancer, to reduce the burden of cancer in the future, we need to take action on environmental determinants today. So we're going to hear opportunities that are both legislative, we're going to hear opportunities that are programmatic and funding, but also about behavior change and doing things differently, all of which will add up to a momentum for change that will reduce the number of cancers that we could expect to see from environmental exposure over the future. So I'm delighted that launching the point and joining me today, we've had Hans Brunings, the Executive Director of the European Environment Agency, and he's been many times here to Friends of Europe to share his expertise, and we're delighted that you're here to give us an update in this particular report. So Hans, please go ahead.
Thank you very much. It's a pleasure to be here and to indeed explain a bit what we have included in the report, which was launched today. And I would like to say that this is a report that is really the result of collaboration, because this is the type of field where you have to collaborate with specialists in a variety of fields to come to the type of understanding that we are bringing in the report, and that hopefully can drive policy advances as well. Well, the subtitle, I think, says it all. I mean, we're dealing with a serious risk, but a risk that can be mitigated and to a large extent avoided if we take the right action. And in this case, of course, as an environment agency, we are focusing on environmental policies that can reduce cancer risks. And why is that important? Well, with a bit less than 2 million new cases a year in Europe, on cancer, we are looking at the environmental determinants of cancer. And if you look at the first non-communicable disease in Europe, it is actually cancer when you look at environmental pollution and its impact. So it is really very serious. And about 10% of the cancer cases in Europe are caused by environmental and occupational risks, because those are the 2 categories that we are looking at. It's also important to point out that these risks are not equally spread across Europe. We know in general that the link between environment and health has a number of injustices in Europe, and these are all the premature deaths attributable to the environment in Europe. It's more than 11%. You could say 1 in 8 people dying in Europe is linked to the environment. And if you look at the map of Europe, it is quite clear where we see a much higher link between environmental pollution, occupational risks, and premature deaths. Unfortunately, we have indeed about 2.7 million new cases in Europe of cancer. And if you look at the most common cancers with men and women, there is a very clear link, especially with breast cancer in women and with prostate cancer in men. So we need to understand what the links are between environmental factors, occupational factors, and this spread of cancer cases across Europe. Unfortunately, we also have a large number of children in Europe that get cancer every year. And I think it is rather clear that we have a moral and an ethical obligation to do everything we can to avoid cancer cases with adults. But if you think of children, I think especially for children who often have no choice through their own behavior or the exposure that they have to avoid cancer. Okay, well, air pollution. We do a lot of work on air pollution, and policies on air pollution in Europe are under revision. Yeah? So it's important to point out that about 5% of the cancer deaths in Europe can be linked to air pollution and radon. And if you look at the map of Europe, again, you can see that this is a rather unequal geographic distribution. So we have every reason to work on air pollution since it is linked to a significant number of cancer cases. And this is across our whole body, unfortunately. Air pollution can be linked to about 17% of the lung cancer cases, but if you look at where air pollution, you could say, invades our body and causes cancer, it is pretty much across our whole body. So again, there we have every reason to focus on air pollution as it is closely linked to cancer cases. Now, if you look at chemical pollution in Europe, and quite a bit of that is also in the occupational sphere, it is also clear that a number of chemicals in Europe for which we do risk assessments, or we sometimes don't do serious risk assessments, that they are also linked to cancer cases. And working together with the European Foundation in Dublin and using their data, they had self-reporting of workers on how much they are exposed for more than 2 hours a day to chemicals. And if you look at Europe, there is a quite significant difference, but on average, it's 17% of the workers who self-report that they are exposed for 2 hours or more. And in the work sphere, we estimate that about 4% of the cancer cases, resulting in 80,000 deaths a year, are linked to carcinogens at work. So again, this is a significant place, I would say, of fighting pollution and improving public health. Now, the good news is that almost all environmental and occupational risks can be reduced, yeah, if we apply the right policies. And in Europe, we have phased out asbestos, but we are exposed throughout the day, throughout our life, to multiple chemicals, multiple forms of pollution, multiple occupational settings, and that results in a certain pressure on our system, our bodily systems, and that results in cancer. But we can do something about that. The acquis of Europe has already reduced the risks, but it should be further improved. Think of air pollution, but also of the new chemicals strategy and other policies. Now, what do we know about chemicals and health? It's like an iceberg. We know quite a bit, yeah, and I'm not going to read through all of that, but working together with the Occupational Safety and Health Agency, working together with health professionals, working together also with the Commission here, DG Employment, we know that in certain spheres there is a pretty good knowledge, and we should use that knowledge to really drive policies towards better public health and better environmental health. But there is quite a bit that we don't know yet. And there I think there are three core messages. One is we should keep investing in knowledge creation and production in a networked way, a way that connects the dots. Secondly, we should reflect that knowledge in our policies. And thirdly, I think we should understand that Europe also has a role to play in global production and consumption chains. This is not an isolated European setting, so there is quite a bit of work that still needs to be done. Now, Europe is, of course, putting a lot of emphasis on fighting cancer. And in the health sphere, there are a number of initiatives that are taken, and I'm sure many of you are connected to those. The same is true on the environment sphere, but let's put it rather simple. In the health sphere, the emphasis has not often been on environmental determinants and on making that connection, and on fighting pollution in the environmental sphere, one has not really focused a lot on specific diseases or on health. So the drive in the Green Deal on strengthening these agendas is the right drive, but it would be even better if the explicit connections between the two would be stronger. And luckily, Europe is working towards that. In the Beating Cancer Plan, there is an explicit link with the environment. On the pollution side, zero pollution, and we work a lot with zero pollution. We are doing a lot of the base work in terms of monitoring and reporting. A lot of the very specific goals, pesticides use, air pollution, health impacts of air pollution, transport noise, microplastics, a lot of these goals have a really direct impact on public health, and a number of them have an explicit impact on cancer in Europe as well. So making the links is absolutely critical. Communicating our knowledge in a way that is understood by citizens and not only by policymakers is another emphasis for the agency. In the air pollution field, we've made our air quality app that connects up-to-date, near real-time data on air quality, your health situation, pulmonary disease, for example, and gives you health warnings. It is the type of easily accessible knowledge that we are also focusing on based on our knowledge. We're also doing this for climate and health together with ECDC, EFSA, a number of the other agencies and scientific organizations. I think this is the way forward to communicate knowledge to citizens, and we will also do that in the field of cancer. Let me wrap up by saying, first of all, most Europeans, in a direct or indirect way throughout their lifetime, will be impacted by cancer themselves, their family, loved ones, friends. I would say all of the risk factors can be mitigated or reduced, maybe not completely eliminated, but seriously reduced. So we should work towards that, because we're talking about more than 10% of the cancer cases, and we think that these estimates are conservative, as we probably underestimate chemicals risks to cancer. We need to do this today, because what we do today and the pollution we have today will be producing the cancer cases of tomorrow. And a zero pollution action plan on the side of the environment is probably the most important policy that we can strongly implement towards contributing to the goal of beating cancer in Europe. Thank you.
Thank you very much, Hans. It was very clear, and also some very well quantified data there for people to reflect on, to digest. I think it's now becoming increasingly clear, the environmental burden on health, and as you said, that's 16,000 children's cancer cases a year and 2,000 deaths. So even if we address the workplace exposure, we're still missing the bigger societal challenges that affect the rest of the environment. So thank you for that. Let me invite Wendy Yarra to come and join me, the director for the Association of European Cancer Leagues. Now, Hans mentioned that in the past, we've often had a silo approach, that the health environment didn't necessarily engage so much on environmental issues, and the environmental community didn't necessarily engage on health. And now is the time to join those dots. So for some in the cancer community, as we've seen things like air pollution and radon, it's not necessarily new, the link to environment, but it is to others. And many of the choices that affect these environmental determinants lie outside the health field. So what messages do you think are important for people who do work in those other fields that are in charge of those policies, like urban policy or others? What do they need to know?
Thank you very much for that question. And Hans, thank you very much for the very nice summary of the report. We very much welcome this report. It's rather late in coming, but we're better late than never, so this is fantastic. Now, you mentioned that, and you both mentioned that there's been, we've been working in silos. We've got the cancer, and then we've got the health community, and then we've also got the environment, not necessarily in sync. I actually don't see that, and maybe it's because we have always been working with stakeholders like HEO, for the environment, the alliance, and so for us, it is very important that people know about the European Code Against Cancer, which has been in existence for 30 years. So for us, that's a code that has been in existence for 30 years, mentioning how people can prevent their risk for getting cancer. And so for me, it is very surprising that, well, first we did a survey, and it was very surprising to us that not many people know about the European Code Against Cancer, which does mention such things as environmental risk factors. But another thing is that we're surprised that the other communities haven't been mentioning this. Now, it was updated not long ago, so now we're in the 4th edition, and we clearly specify the environmental factors. But before I go more into answering that question, if I can put environment cancer prevention into context. So the cancer burden in Europe, you did my talk for me. I mean, you outlined all the statistics, so that's fantastic. I'm not going to go too much into it. But, it's kind of sombering, the statistics. More than 10% of cancer, is caused by exposure to pollution. Wow, how can you avoid pollution because it's all around us? But let's look at the positive side, on the positive side. Around 4 in 10 cancers can be prevented, okay, according to the current scientific evidence. So we're always talking about the current scientific evidence, and this is something that not everyone knows about, and I think people need to know more about this, especially the workers, because they're the ones who are really impacted. So the challenge is actually putting the scientific evidence into practice. Now, to support this, I was telling you the European Code Against Cancer, it's already gathered top scientific experts. And so if you can take a look at the scientific evidence around this, we have the tools, we have the information. How can we get it out there? How can we make sure that the environmental sector knows about this? How can we make sure that the health sectors know about this? And that's fine, because all the experts would get together and say, okay, this is, we know about this is terrible, how can we prevent it? But what's important is that we get the general population to know about this. And I think this report is fantastic because it's getting out there in the media. I heard on the Belgian radio today, they were mentioning this. They didn't attribute it to EA, though. They only said, they started talking about the environmental factors and its link to cancer, and I thought, how odd, because, and then they, I guess it's part of the media trick where, they make it sound like, oh, this is so terrible, and, we're all doomed. They didn't mention anything about the scientific evidence, what you can do, how you can prevent cancer, and I think that is a message that we need to get out there, not only to the general population, but also to the media as well. So, your question about working together, I think, or so I think we're already, it's a good start. We've got, you mentioned already the Europe's Beating Cancer Plan. It already mentions the environmental factors. I think we need to go beyond that. We need to, we've got the cancer plan that really was the basis on releasing some funds for our work, cancer work related to other factors, and I think that's really a good start. But I think we need to do more, and we do need to work together more. For example, you've probably been lobbied by many organizations and industry. You know, we need to somehow work with industry. How can we work together with them to make sure that, well, they behave, if I can say it like that, because there's so much that they can do. And, you know, you have, not all industry is bad. You have some companies, they say they're doing a fantastic job, and then you maybe see that they're not, but then you actually have some companies who are really trying to make a difference. And I think we need to give them credit for doing that. So I think really, in general, we need to make sure that the people realize that there's, you know, health literacy, environmental health and cancer literacy out there among the general population. How can they prevent cancer? There's so much they can do. You know, for example, the workers, they don't know. I mean, they're in their daily jobs, so for them it's not so important, or they don't realize that they're exposed to chemicals. Asbestos, okay, we stopped manufacturing that already, but it's still in many buildings. And, you know, how do we make sure that to go around and make sure that the asbestos is all removed? That's going to be a huge task, and that just costs money. And I think we need to really go to our policy makers, our politicians, and get them to make some changes for the general public. Now, there's some messages in the European Code Against Cancer that is a bit more difficult, I think, for an individual action, such as radon. That is a message in the European Code Against Cancer. Many people don't even know what radon is. Okay. And yeah, so a lot of the questions, so when I go around and, you know, I'll be traveling, I'll be in a taxi, and then they'll say, oh, you know, oh, you work in cancer. Oh, that must be such a depressing field, you know, because people just get in, there's nothing you can do. And I had to tell them, no, there's a lot you can do. And then I'm always surprised that people do think that there's nothing they can do about it. And I think we need to get that message out there. So back to radon, there are ways to measure it. There are ways to decrease your risk, airing out your homes. And, you know, you have some countries, when I speak to some politicians, they say, oh, we don't have radon in our country. I said, how is that possible? You need to make sure, there are maps out there, there's a lot of evidence out there, you know, testing for radon. And now, I met a company in Spain, they actually do the radon testing as well. So, I mean, there are many things you can do, but I think, you know, for areas such as radon, which is more difficult because it's coming from the ground, you can't change the earth, but you can lobby your politicians and policymakers to make sure that there are regulations to measure it in your homes, so that you can get grants and funding to be able to do something like that. And then back to our workers, environmental factors. We need to educate them. We need to educate the bosses of the companies, not just the workers, because the workers, they're subject to the conditions, so we need to go to the human resources, we need to go to the large companies and explain to them, you can protect your workers.
Great.
It's just one last point, because, you know, we all know that cancer takes decades to develop. So oftentimes, you know, the cancer and it's increasing because of the aging population. So now we hear, you know, oh, you got cancer, and I was actually surprised that people don't know that it takes decades to develop. They said, oh, I was diagnosed with cancer, I think it's because of COVID. And, you know, when you hear something like that, it's just so depressing, because there's so much that people don't know out there, and we really need to work together to make sure that the evidence is out there and that people understand that they can prevent cancer in so many ways.
Thank you, Wendy, for giving us that clear message that we can do something both at an individual and institutional and society level to raise awareness and understand, and all of the different areas and ways we can do it, from radon exposure in homes to workplace and to general understanding. Let me open the floor for a few minutes to just see if any of you have questions for Hans, or if you'd like to have a question also to Wendy. Is there anyone who'd like to ask a question? If not, I'm piling up my questions over here, and I can see hands will want to come in. Yes, please go ahead. We'll give you a microphone. It's coming to you. If you could just let us know which organization you come from.
Hello, and thank you, Hans, for your really timely presentation. I wish we had that, as Wendy said last year when we were doing the cancer plan. I'm from the Greens IFA group at the European Parliament as their public health advisor, and I would have two questions. because we have a lot of talk political about the One Health concept, and we have a lot of politicians who love to blast about One Health, and then when it comes to the actual policies, they never actually vote in favor of the One Health. They actually vote alongside the bigger lobby groups and where the money goes. So I would just like to know if you have any ideas, how can we, you talk about communications to the public, but how can we actually communicate it better to policymakers that they should actually follow up through with what they're saying in the speeches, which are really always nice, but then when it comes to the actual policies, it's a bit lagging behind. And then my second, because you also mentioned Horizon, and obviously we have the cancer mission there, and there again we have another problem where a lot of the money, I think, we are focusing on, if you're saying unmet needs, then it's always about patients and finding new therapies and very niche, very techy treatments. So do you feel that there is enough sort of within that program, enough attention to, for instance, finding those research gaps that you said that we have for chemicals? And how do we make, how can we help you also to do it from our end as co-legislators? Thank you.
Great, thank you. And Hans, I note that you did say there were sort of 3 things we needed to do, and your second one is better reflect the knowledge that's been generated in policy. And I think we've just had an example of some of the challenges of getting the knowledge you put out into policy. But also, if you might like to comment on this issue that, you know, the focus under the research program under health and cancer is very much on treatments and people who have cancer, but not enough going at the issue at the upstream prevention.
In general, I think prevention in healthcare approaches has not been the key focus, but we know that there is a ton of research on that. On a positive note, though, I would like to say that Europe has just embarked on the largest networked knowledge building around the assessment of the risks of chemicals with the PARC initiative. We are part of that, as is the Chemicals Agency, the Food Safety Authority. It is building on human biomonitoring for the EU, where indeed we make the link between chemicals exposure, risk assessment, and healthcare outcomes through a variety of pathways. So that, I think, is the positive news. And nearly all countries in the EU are embarking on that. Very briefly, 2 other things. How can we convince people that investing in this type of policies is the right thing to do? Well, first of all, it's cost effective. I mean, the cost to healthcare systems of bad health is massive. The cost also to the economy, if you want to take that sort of thinking, because people are less productive, healthy life years are lost, all of that. But, I mean, that are costs. I think the critical message is we are investing in our health. It's not a cost. It's an investment in public health, in individual health that is beneficial to society. And my last positive message is that if we implement the European Green Deal ambitiously and fully, strong implementation, it will result in a massive improvement for human health in Europe as well. The chemical strategy, zero pollution, all of these things have a direct link to human health. So strong implementation of the Green Deal is not only good for the environment and for climate and for all the other things that we value a lot, it is the right way to go for our health. So that would be my strong message there.
Can I just add 10 seconds just to what Hans said and what Anna was asking about the chemicals? Because you're saying, you know, how do we talk to the citizens and encourage and convince them that this is good? So I was thinking when, you know, Anna brought up chemicals, I was thinking the PFAS, you know, which is known as the forever chemicals. And we're trying to do something about it, you know. We have to all do something about it as a community. But I'm thinking, you know, if you're talking to the general public and telling them it's cost effective, and I'm just thinking that if it's my neighbor, you know, hearing this, they would just blank out, it's cost effective for whom? For you, but, what does it mean for me? And I think we need to kind of get the message out there regarding, like, for example, if you look at the PFAS, and, you need to be cost effective, help us be cost effective so that we can eliminate or do more research around this and eliminate the dangers of chemicals such as PFAS from our environment.
Thank you. Let me now bring in two more members of our panel to add some greater depth. And I'm delighted to invite Jane Burston to join us, the Executive Director of the Clean Air Fund. She's going to tell us a little bit more, particularly about the multiple stakeholder roles. Wendy, stay up here because you're part of our panel, yes. Jane, to get the kinds of policy changes that Hans has been talking about, it's going to require joined-up thinking and lots of stakeholders. Hans talked about the generation of knowledge in a connected network way, but we also need policy to work in that way. So who's already active on this and making change happen, and how do we make the links to get more people involved?
Thanks, Tamsin. So the Clean Air Fund is working on air pollution specifically. And we can see quite a few different groups involved in lobbying for change on that particular topic, not least health practitioners, so I won't steal Dr. Alex's thunder by talking through all of the additional health effects, as well as cancer that air pollution brings about. The other four groups are businesses, parents groups, environmentalists, and mayors, city mayors. Starting with parents, I think that they very often can see the effect that environmental pollutants are having on their kids. And you often hear about these very high death statistics. That's mostly older people who are more vulnerable, but also children who've breathed air pollution from an early age and even have been affected in the womb have really severe consequences for the rest of their lives. And they're more vulnerable because they're developing physiologically, so their lungs end up smaller, their brains end up smaller, but also because they're more exposed. They're outside, a lot of the sources of pollution are close to the ground where they're breathing, and they breathe faster, so they take on more body weight, but more polluted air per body weight. So parents get really angry about this, and although parents are one of the busiest groups in society, they're getting out and lobbying on the issue. I think environmental groups is another big one, the most obvious, I guess, because a lot of the air pollution that we're talking about here has the same source as greenhouse gases. So if the solutions to climate change and to air pollution by and large can be the same thing. We often see actually that when you're trying to engage the general public, talking about the health effects of air pollution is something that people can understand really easily. Talking about fumes is just more tangible and immediate sometimes than climate change can seem to people. Businesses have been slow on the uptake, I would say, but they're starting to get involved. And I think this is because of the greater focus on business responsibility for health more recently, the effects of the pandemic, and obviously how people who've had historical respiratory problems have been more affected by COVID, and those historical respiratory problems have in a lot of cases been caused by air pollution. So it's kind of raised the profile of health for businesses. But also because of the increased focus on equity, because the people who are the most exposed to air pollution are usually the lowest income in society, and businesses are, they tend to be, the lowest income groups tend to live on the edge of busy roads, they tend to live next door to industrial facilities, and people are starting to say, hang about, the effect that you're having on these groups is not fair. And we've also seen, because of the health effects on the working population, businesses are starting to care because of the productivity effects. We funded the Confederation of British Industry to do a study, and 3 million working days are lost each year in the UK that would be saved if the UK met WHO guideline limits. And that's not even the new ones. That was the old, less ambitious limits. So then finally, we see a lot that city mayors are getting involved. And I believe it's because they're closer to the problem. You know, they're closer to the population. They can see the health effects more readily, especially exposure around schools and hospitals. And so and they've got a lot of the powers that they need to tackle air pollution. Not all, but some. And so we've seen action there. We've got 37 mayors have already signed up to meet the WHO guideline limits as soon as possible, and that's not just in developed countries, that's developing countries as well. There's no national governments, I believe, who have signed up to do that yet. And they're taking action. So we have examples from Sofia, where Dr. Alex lives, where the city is committed to a low emission zone. I'm working actually with one of the European young leaders from the Friends of Europe program on a project in Warsaw that's trying to bring some of these groups together, measuring pollution, working out the health effects, doing campaigning with local supporting local groups to do campaigning so that the policies take all of their considerations into account and are equitable. And supporting local businesses to get involved too. So I think finally, you know, when Wendy's calling for different groups to work together, I think on a city level it is starting to happen across the board with these groups.
Thanks very much, Jane. Let me now bring in Dr. Alexander Smitchev. You're a member of the Bulgarian National Assembly, but you didn't start off that way. You started as a clinician working directly with patients as a medical doctor. Then you became a campaigner on air quality, probably, you know, some of the things that Jane talked about, you know, talking to parents, getting out there, and now you're a parliamentarian. Can you tell us about that path? And, you know, now what do you want to achieve as a parliamentarian to tackle the problems you saw as a clinician?
Thank you very much. It's a great pleasure being part of a member of this panel because first of all, there's people I know really well. Jane, hi. Second, because I highly value all the input that Hans and Wendy had for this topic. A little bit about myself. I'm a clinician with 30 plus years of academic and clinical pulmonary medicine, so I'm a lung doctor. After that, about 5 years ago, when my first grandchild was born, I became a campaigner for clean air because one of the things I had borrowed from an old Indian wisdom is that we do not receive the earth and the air from our ancestors, we rent it from our children. So if we want to give it back in a way that will be a well-used earth and a cleaner air, we need to think about our children in the future. So that's when I became a campaigner for clean air. And I quickly came up to a bottleneck because there's only so much you can do as a non-government organization. And you can lobby, you can spread information, but in order to achieve policy changes, you need to be effectively very close to the decision makers. And COVID helped a lot because along with clean air, I was also campaigning around information around COVID and vaccinations. And so I joined the Bulgarian parliament as part of the Democratic Bulgaria coalition. And from there, I quickly understood the high level of complexity that actually policy requires. But I also saw that there are ways which you can achieve lasting change. And that requires a significant portion of consensus within parliaments, which is currently not the case. So this is where, together with Jane, we started a very interesting project, which I hope will become one of the success stories of Europe. Jane supported our organization, which is called Air for Health Bulgaria, to establish a group of ambassadors, healthcare ambassadors, physicians who are actually ambassadors for clean air. Most of physicians, and I know that from talking to my colleagues, most of physicians do not appreciate any of the really big health impacts that air pollution has. We often think that physicians would know that, but actually that is not true. Many physicians look at diseases as a case in front of them. They don't really look at the history behind that. And this is why prophylaxis is not as prevalent as it should be. And this is why reports like the Environmental Protection Agency report do not get the resonance they need to get in front of physicians. But once physicians realize this, and we've seen that with our ambassadors locally in Bulgaria, close to 30 physicians who are part of our network for clean air, they start actually seeing environmental pollution as a very different factor which is modifiable, especially when we can achieve healthcare legislation, and not only healthcare but environmental legislation, which can actually be changed very quickly. And by quickly, I mean in political terms, about a year. This is something which I've put my efforts towards in the last 1 year. A member of 3, not only 1 parliament, which says a lot about the stability of the Bulgarian political system at the moment. But anyway, even though the political system is unstable, even though we have a war close by our borders, even though we have a significant economic challenge with the similar challenges most of European countries face, we can achieve a lot if we work together with our partners, both internal and external partners. Internally with the healthcare community, with the parliament, with the executive branch of the government, and also with non-government organizations, who many of them are our friends and supporters. So what we need to do is give the problem, and the EPA has actually stated the problem well enough, have a solution, which many of the non-government organizations actually offer different kinds of solutions, and also we have the low emission zones, etc. And thirdly, but not last, we need to find the right moment when this can be introduced into the political agenda, because this is something that can happen, but only if we find the right moment to introduce it in the political agenda, because politicians have a very short attention span. It's probably shorter than a goldfish's. So that's why we need to put the problem, the solution, in the right moment in front of their attention, so that we can achieve a lasting political policy change and agenda change. And I very much look forward to working as a team between parliaments and together with our NGO and umbrella organizations to achieve lasting change for Europe.
Thank you very much, Dr. Smityev, and we're hoping that our politicians can extend their attention span just a little bit beyond the goldfish to grasp some of these, because the point we're trying to make about cancer exposures is it happens over multiple years and possibly decades. So to prevent the cancers of 2030, 2040, it's action now. So now I'd like to open up the floor if people have questions that you'd like to bring in, and I have a couple of questions already for Hans I'd like to take in, but yes, if you'd like to ask your question, we're bringing you a microphone.
Thank you. My name is Joan Delaney. I'm a founding member of La Maison du Peuple d'Europe, which is a think tank in civil society. We have started to deal with environmental issues. And I would just quickly, briefly ask Hans, you did show us the geographic spread of a number of the issues, but you didn't make any comment about the darker areas. Perhaps you don't wish to, you don't want to point the finger or describe what's going on there. Thank you.
Thank you. Okay, so Hans, would you like to pick up on that some parts of Europe obviously have heavier pollution areas to deal with?
Yeah, actually, we've done that on multiple occasions when it comes to air pollution. It's the energy system, coal-based, but also domestic heating and cooking in major parts of Eastern and Southeastern Europe. Then you have the Po Valley, which is always a hotbed of air pollution. And then you pretty much have the area that is here and goes into the Netherlands and Ruhrgebiet, North Rhine-Westphalia. Those are the hotbeds in Europe for air pollution, and that has to do with high density population, traffic, and industrial areas. So, and we could do that for other areas. But I think your question is highly relevant, and in fact it's so relevant that with the group in the agency that is working on environment and health, we are preparing a social health atlas for Europe, where we are much more granular than what I showed on the map, and where we will be putting data together on socioeconomic issues, with data on pollution, with data on health outputs or outcomes. So we are working on that. It should come out next year, and it will be an interactive web-based product. So it's on the way.
Thank you, and I think that will be really interesting for many of the campaigners who've worked on health inequalities to finally be able to see how the social determinants of health overlay with the environmental determinants. We suspect that they are very closely linked, but I think your data is going to give us the hard evidence we need to put pressure on local government and national government. So thank you for that. Hans, can I just ask you something? You mentioned there were 3 points in the beginning and that the EU is part of global value chains. Now, in Europe, we've got this new approach around sovereign autonomy. We realize that we need to be bringing back on shore some of the things that we've offshored in the past. What do you see as the impact there? Because in the past, Europe has been criticized for essentially pushing manufacturing away, so exporting pollution. And now that we're looking about how do we understand our industrial base in Europe more strategically, to what extent are we able to make that clean industry, or is it a new problem that we're going to have to deal with?
I think there are several parts of a response to that. First of all, I think it's fair to say that the current Commission with the Green Deal is focusing more on that than we've done before. With the food system, deforestation, in climate change as well, it's an issue that is discussed now more than in the past. So that's good. Secondly, the JRC, ourselves as well, we are increasingly looking at that external footprint of European consumption and also the externalization of production. So I think it is a topic that is more and more relevant, and it's also a topic that is extremely relevant in any global negotiation on whatever climate or environmental deal we are talking about, because it is part of the legitimacy of Europe to take responsibility for the full impact of our lifestyle. So I think that is definitely out there as an element. Now, most of the governance that we don't do along value chains. It's territorial based. That's the basis of a lot of our governance models. So I think innovation in governance that attributes responsibility, but also intervention logics across a global value chain would be one of the ways forward in global governance, and that does include responsibility for pollution and amongst other things, the health outcomes of that.
Thank you. Wendy, I know you wanted to come in, and then I'll take another question.
So just very quickly, because you said innovation, and you mentioned evidence and research. And I think what hasn't been mentioned here is looking at the best practices. And it just struck me because, Jane, you were talking about the local community, and then Alex was talking about working together with NGOs, and it just made me remember that, for example, and you also mentioned in Southeastern Europe also that it's redder. I don't know what color Spain is, but I just want to put it out there. There's an example, the Spanish Association Against Cancer, they decided to really put this as one of the main priorities, and so they've done a lot of work, and probably because they got support from the mayors, environment and cancer. So if you go to Spain, more than likely you would see the beaches are smoke-free, for example. And how they got to do that is amazing because, Spain is one of the countries where they do have a high prevalence of smoking. So, that they were able to get that done. And I think we need to see more good practices and examples like that, and I think this event is a great idea to be able to put those best practices out there.
Thank you. Do we have another question here in the room you'd like to ask our panel? Alex, please go ahead.
Can I just interject a bit? Because I had a little bit of a vantage point on both the high prevalence areas, because I come from one. The southeastern part of Europe is a bit darker than the rest of Europe. And actually it touches on the One Health issue too, because ultimately the amount of influence environment has on a person's health is mediated by the quality of the healthcare systems. When healthcare systems do not work well enough, mortality is increased across the board, including environmentally related mortality. So it's not only about the pollution itself, it's also about social determinants of health, for example, how well the healthcare system is functioning. And then that comes back to the One Health element of the European policy, which needs to be rethought again, because unless we have a common denominator of health, we cannot really just attribute it just to environmental pollution causes.
Thank you, Dr. Smichev. That's very interesting, particularly, as you say, because Bulgaria is a country that was dark red on the map. And I'm wondering if you could give us a little bit of insight. You went from being a clinician to a campaigner to a parliamentarian at national level. What do you need or expect from the European level to support the work you're doing in the national parliament?
Well, actually, I've always been an evidence-based person, and having European-wide relevant evidence generated for a multitude of oncological conditions, and not only oncology, but across the board in healthcare, is a strong start. But then European Parliament and cross-parliaments, multiple parliaments within the countries having common topics around significant social issues, and these issues may include and not only be related to healthcare, but also social inequity and many other topics. These are key elements that differentiate countries between each other, because one is the amount of money a country has, but many of the really significant healthcare interventions which can happen are not that much related to money. For example, prevention is one of the cheap elements of improving healthcare, and it's extremely effective if well planned. And one of the ideas I was trying to put forward both nationally and hopefully internationally is, if we're going to have One Health starting from somewhere, it should start at the prevention level. So we need to have common preventative strategies across all healthcare systems around Europe related to, for example, women's health and breast cancer and gynecological cancers and colon cancer and lung cancer, et cetera, et cetera. The lung cancer is a significantly difficult one, but it's something I have experience in, and for the last 3 years we've tried locally and now internationally to form a consortium where the high prevalence of lung cancer in Bulgaria can be used as a control group and comparator group to lung cancer cases in other European countries, so that we see what works and what doesn't. So it's a joint approach across the whole territory of Europe, and use the territory with its differences to help generate ideas and data that will help us identify which are the crucially important elements of improving healthcare.
Thank you. Jane, I wonder if I could come to you for a moment, because you mentioned that actually, the drivers of climate change are often the drivers of environmental impact. So given that we have the Green New Deal, we've got the Recovery and Resilience Funds, and a lot of efforts going into that, to what extent can we sit back and say, well, the work that's being done on climate change will give us the environmental benefits, so yippee, or do we need to actually look broader that and do more than the carbon transition mechanisms?
Definitely more. No, I think it's a good thing to emphasize the co-benefits. There's a technical jargon for it, because it helps push the climate ambition and it helps push the air quality ambition. The two things are not always the same. So 2/3 of outdoor air pollution is from the burning of fossil fuels. So where the source is burning fossil fuels for the sorts of things that Hans mentioned, energy production, domestic heating, transport, then the solutions can be the same thing. But then there are some things that are good for air pollution and not good for climate change, and vice versa. So we do have to be very careful to make sure that the net zero plans also are good for our health. Biomass is one example where burning biomass is really not good at all for air pollution, but has been termed carbon neutral, or because wood could be called a renewable fuel by some. So I think we just need to be careful and make sure we're always trying to maximize the climate benefit and the health benefit. I think that there's opportunities. Yes, we've got kind of strong climate commitments, but there's opportunities to bolster those with strong air quality commitments. The EU is at the moment looking at a revision of the ambient air quality standards, which will happen next year. And the WHO quite recently have brought down the level of kind of safe air pollution. I mean, there is no level of safe air pollution actually, but they've brought their guideline limits down. And so everybody's looking to the EU to see if the EU implements those into law and by what timetable. So I think, you know, for the groups in this room, if it's not if you're working on the health issues and that's not something that you're working on, I think now is the time to start raising how better air quality standards can improve health.
Thank you. And let's just explore a little bit more about what we can do at EU level. And you mentioned potential trade-offs, that it isn't a perfect overlap between climate change and air pollution. And obviously the EU, post the pandemic, it has other priorities. They're looking to restart the economy, looking for growth and jobs again. We've got a cost of living crisis. We've got a war on our doorstep, all of which policymakers have to create a balance. So I wonder if each of you could help us just map out over the next 6 to 12 months where there are likely to be friction points and trade-offs, and on which side you wish the EU to come down on to improve the environmental impact on health. In other words, give us a roadmap for action over the next 6 to 12 months where the EU could make a difference on these aspects. And Hans, it's your report, so I'm assuming that you've got a to-do list, simply because you have those three things in the beginning. You said invest in the knowledge production, reflect that knowledge in policy, and remember that EU is part of global value chain. So I'm assuming you have a to-do list underneath that. So give us some insight what's on that.
Well, there are still major parts of the European Green Deal that are in a legislative train. And I know there is a bit of pushback at this moment to slow down parts of that, or to be a bit less ambitious, or to be very careful, because this is not the moment to disrupt economic actors. And all of that, of course, has its own merit as reasoning. But I would say this is the time to stand by the European Green Deal. If nothing else, science is telling us year after year after year that a systemic approach, which is deeply embedded in the Green Deal, is more urgent than ever. That is the needle on the compass. We should not slow down how this is implemented. And it's the clean air, it's REACH that is under revision, it's the implementation of some of the core concepts of the chemical strategy, safe and sustainable by design. If we really go for that, it will have a massive impact on environmental quality, but also on human health and on cancer. So let's push for that agenda, knowing very well that the macroeconomic conditions are what they are, but also understanding very well that a lot of the debate will be about distribution and fairness in how we implement these elements. A last thing I would like to say is we should also emphasize with our citizens the positive linkages that we can make. For example, greening of our cities has impacts on air quality, on noise pollution, on cancer, on human health in general. Those are things we can do and we can showcase, and where we can involve citizens and create local understanding of why these things matter. So this is not just an agenda of more regulation on industry, more regulation on this level and that level. It is a positive agenda for change. It's a positive agenda for human health, for the environment, and we have no alternative. I mean, what's the alternative to a sustainable society and an unsustainable society? I mean, that's intellectually, it's a ridiculous idea. So we have no other option than to go in this direction. And we should not be sidetracked in terms of direction and speed. The conditions that we are living under should emphasize certain dimensions of these transitions, and that is equity, and of course the type of use we make of public and private funding. And that's where I think the emphasis should be.
Thank you. I think you've demonstrated very nicely what Dr. Smitshev said earlier. You know, we need the science, the evidence, we need potential solutions, and the window of opportunity. And you've highlighted for us the Green Deal is there. We've got the update of the chemicals and REACH strategy. The windows of opportunity are there. We must seize them and keep going. Jane, I saw you nodding several times. So would you like to go next?
Yes, I mean, so two additional friction points building on what Hans just said. I think one is obviously the cost of living crisis and making sure that the policies that get implemented don't burden the people least able to afford the change. You know, we talked about low emission zones before. It's the poorest in society that don't even own a vehicle, and then the next poorest that can't afford to switch to a cleaner vehicle. And there are many cities in which there is not sufficient public transport, especially for people traveling in from outside. So I think making sure, that's one potential friction point that we're going to have to tackle. Another one that we haven't really talked about is the transfer of pollution from west to east. Taking vehicles as an example, when combustion engine bans get put in place in France, UK, the cars get in low emission zones and it gets more expensive to own polluting diesel vehicles in those countries. The cars get sold to East and Southeast Europe, you know, and from there to Africa. I think that needs to be tackled. We need to look at actually what we do with that very polluting infrastructure and retiring it, scrapping it, rather than allowing it to be sold on. And the two opportunities I think that the EU has, I mentioned the Ambient Air Quality Directive, which is the biggest one coming up. I think they need to sign up to the WHO target as soon as possible, and an interim target as well with a near-term deadline. And the second one is making sure, kind of playing to that cost of living point, and the transfer of pollution point, making sure that the budget is available for those most in need to transfer to cleaner alternatives. So, for example, there is already a big program in Poland at the minute for the replacement of coal boilers in people's homes, making sure that that gets expanded to all countries that need it, and thinking about whether that budget could be made available to cities as well as countries, because cities are the ones that most often have the capacity to support individuals to spend the money. Sometimes at a national level, that budget gets stuck.
Thank you. Wendy, what would be on the to-do list?
I think it would be really important for us to focus on reducing the dependency on synthetic pesticides. You mentioned greening, and a lot of times the greening, people might think, okay, to make it more green, then you need to use pesticides to make sure that it's all green. But we need to really pay attention to that. And then you also mentioned equity, Hans. And I think here we need to look at, for example, here, the farmers. You know, definitely they are a marginalized group. They're exposed to pesticides. You know, and we ourselves should not think that just because we're not farmers, we're free from the pesticides. It's everywhere. It's in your food, in the food that you eat. You know, make sure that's washed. So I think we need to really have the EU, and at the EU level, but also at the national level, do more to reduce our dependency on synthetic pesticides.
Thank you very much. Again, very practical message there. I'm not sure if we're still able to speak to Dr. Smitshev, if you're able to join us again, because we can just see your face, because it would be great to hear what we could do at European level to give you more space to do it.
I've just been informed they've started the session in the Bulgarian Parliament, so it's not
apologies, had to go back. National parliamentarians have to do national jobs. That's
No,
clear.
I just...
hello, Alex.
I'm coming out of the Parliament just for a second, because we're currently voting on several very important topics. But I just, because I was listening to what you were asking, Europe can help a lot with positive examples, what works, why it works, and also data generation, which would allow us to have evidence-based solutions actually being implemented in our local parliament. And of course, if we think about social justice, it would be spreading this information around the whole of Europe, especially to underprivileged regions, because otherwise there will be very little justice.
Excellent. Thank you very much. That's a really good message to leave us with. As you say, the data that we're going to hear, and Hans said you're going to be producing this interactive socioeconomic and environmental map, I think will give huge amounts of power to local campaigners, local politicians who want to achieve change, who want to understand, you know, what's happening in their area and what they can do about it. So thank you for that, Dr. Smidziew, for sharing how we could empower you to operate more, and we release you back to your national parliament activities. Thank you very much. So members of the panel, you know, if there's one wish that we could have, and you know, Hans, there'll be another report, I'm sure, in a year's time. What do you hope we will have done in a year? Anyone on the panel, just before we close?
And I've said this before, I hope that and this is, what do you hope the EU will have done?
What do you hope will have happened? So if that's your number one wishes for the EU, then please go ahead.
Yeah, I think strong ambient air quality directive standards.
Very good. Yes, Wendy.
I have a long wish list. So, but really, basically to work together more, and Alex already pointing out, looking at the practical examples and make sure that we can duplicate them in many of the European countries. And then, yeah, and then having this new report really is helpful, but there are some points that I think that do need to be strengthened, and I hope that you will listen to NGOs such as ours when we feedback on what we would like to see when you update it.
Great. Hans, last message.
Stay the course. I mean, Europe has the most integrated, hopeful, forward-looking systemic policy project ever in the field of environment and climate. It will bring huge benefits also to human health. So even though the times are difficult, stay the course, involve citizens, and push through the Green Deal with high ambitions. And if I can have a 10-second footnote, actually, I'm only the poster child usually of the agency's work. It's Gerardo who has been coordinating the work here. We have a small but really brilliant team that is connecting environment to health issues. So I hope you will follow up with more detailed questions for Gerardo, because he knows much more about this than I do.
Excellent. And can I say, on behalf of the audience, both here and watching online, a warm thank you to the members of the panel for sharing your expertise so generously. Thank you all for participating. Have a wonderful summer and see you again soon.
Every night you stay, I'll be